They are at Johns Hopkins University.
Live coverage for you here on News Channel 8. That is Maryland's Governor Martin O'Malley, and this is an Ebola readiness briefing that is happening right now in downtown Baltimore, and we're going to listen in.
Hygiene is joined by Dr. Herrera, also Dr. Lucy Wilson and Dr. Clifford Mitchell, all of them with DHMH, as well as Dr. DePinto, who is in charge of school health at DHMH. We're also joined by, and raise your hands as I call out your names, Dr. Anthony Harris at University of Maryland Medical System, Dr. Trish Pearl at Johns Hopkins, Dr. David Mayer of MedStar, Dr. Anu Answala, who is not only a doctor, but she also serves on our Commission on African Affairs for the state of Maryland, and Carmela Coyle, who is with the Maryland Hospital Association. So as we get into some greater specifics, let me begin by again reminding everyone who's listening that the greatest public health facing Maryland today is actually flu season. So please, get your flu shot if you haven't already gotten your flu shot. That is the biggest public health threat facing Maryland is the usual uptick in flu cases. So get your flu shot. That will also help reduce any sort of needless activity that we would have to otherwise ask our health system to engage in. So get your flu shot. Now let me focus on Ebola. Ebola is tragically taking the lives of many of our neighbors in West Africa. And the only way to really protect ourselves, the best way, is to stop the spread of that outbreak in West Africa. And the only country that's capable of marshaling the resources necessary to do that is our country. And we're very proud of our men and women in our armed forces that the President has ordered to that hotspot of this outbreak. And we are also very proud of the public health professionals who have stepped up mostly on a volunteer basis to protect our lives by identifying, isolating, treating, and containing those who are affected by Ebola in West Africa. And our hearts go out to the victims, and our gratitude goes out to our men and women in the armed services and all that the President has ordered into that hotspot, and also to our public health professionals who are putting their lives on the line in accordance with their Hippocratic oath to protect lives not only in West Africa but also our own lives by containing this outbreak. So our decisions here in the state of Maryland continue to be guided by the best science and the best data and the best protocols developed by the best public health professionals in the world. Fear is not of any use to us in these sorts of circumstances. We don't prepare for these sorts of things by counseling our fears. We prepare for it through tabletop exercises like the ones that we did as a state back in early August, and the other regimens that have been put in place, including a biosurveillance system, one of the best in the country that we monitor, and other protocols as well. Starting today, Maryland will be directly monitoring the health of all travelers from affected countries, namely Liberia, Sierra Leone, and Guinea, countries that continue to battle on the front lines of this outbreak. And these efforts will build on the experience over the last 2 months in active outreach and monitoring by state and local public health officials all over Maryland. So we are a network. We are our own immune system, if you will, of public health. And the way we battle bad bugs is to be better connected and better coordinated and more intelligent in our interventions. And so that's what we're doing. And this will bridge our efforts to work with hospitals all over the state to be able, again, to identify, to isolate, to treat, and contain any cases that may pop up here in our state. With this new plan, screeners at airports of entry will provide names and contact information for all travelers from affected countries whose destination is Maryland. State officials will coordinate daily contact with travelers during the 21 days of possible risk and work with local health officials to provide a smooth, coordinated response to any possible instances of infection, and I underline possible. There will be, given the fact that this is flu season, there will no doubt be cases where people early on wonder if flu symptoms might be related to Ebola. So that's part of our job, is to track that down, to run it to ground, and to make sure that we identify if in case it is a case, and then to isolate and to treat and to contain. So we're urging all Marylanders to become aware of the science here and the reality. And the reality is that the biggest threat to public health in Maryland right now is the arrival of flu season. And people should know that Ebola is only transmitted through bodily fluids of others who are sick. It is not transmitted through the air. It is not transmitted through casual contact or any of those types of things. So people should become aware of the science here and understand why it is that I can stand before you and say that flu season is the biggest health to public or the biggest threat to public health right now in our state. So get your flu shot, and in the meantime, become aware with your own family and your own friends and your own network of coworkers of the actual science here. That the truth is that Ebola is only transmitted through contact with bodily fluids of those who are sick with Ebola. So again, our thanks to all the public health workers who are engaged in this, and many of whom have no doubt traveled from our state and to other states in order to contain this tragic outbreak in West Africa. And I'd now like to turn it over to Secretary Sharfstein to discuss some of the specific protocols. There are, as you might imagine, members of the press, various grades and degrees to our response here, and all of those are adopted in consultation with so many of the tremendous public health officials that stand with me today and that work in places all over the state, including here, where Dr. Sharfstein runs our Department of Health and Mental Hygiene. Doc?
Thank you. Thank you, Governor, for your smart and steady leadership, not only in getting the state prepared for multiple hazards, but in recognizing the potential threat of Ebola very early, holding drills, bringing people together, which made it possible, I think, for Maryland to take a number of steps in coordination with our EMS system and hospitals, including our announcement recently that if there is a case, there are 3 designated facilities where there will be special training and resources to take care of someone. I would also give you some good news, which is from our best estimate, compared to last year, we're 30% up in flu shots in the state of Maryland. So hopefully that message is getting out. Now, this is the 3rd time we've come together. We have, I'm joined by the senior leadership of a number of leading Maryland healthcare institutions to talk about where things stand and what the next steps are. And what I'd like to talk about today is how we're going to be doing the active monitoring that the governor mentioned. And I'm hoping, maybe I have the ability to change the slides here. So I'm going to go through these slides pretty quickly, and then I'll ask for some of the healthcare leaders here to come up as well. So let's see, there we go. So by way of background, the Ebola infection, as the governor said, requires contact with the bodily fluids of somebody who is sick. A person without symptoms cannot transmit the Ebola infection. These are very important facts. And as the governor said, we know that there's a potential risk for 21 days after the last known exposure. So as we're thinking about how we do active monitoring, and we're basing this on the scientific facts, here are some of the key facts. In order to come up with our policy, we consulted with some of the experts and clinicians in Maryland hospitals.
Live coverage for you here on News Channel 8 this morning. That Governor O'Malley and now the state's Public Health Secretary, Dr. Sharfstein, giving a generalized briefing on the Free State's preparedness for the Ebola situation. Should a active case be diagnosed within the state's borders? And of course, all of this comes as there's a fair amount of controversy engendered by the states of New York and New Jersey, both of those states' governors imposing quarantines, which they have then since had to walk back. White House pushed back pretty hard against those over the weekend as well. But we're also expecting to hear today from the Virginia Public Health Department about the Commonwealth's preparedness as well. All of this played out against the backdrop of how to handle returning health care workers from those hardest hit African nations. And the worry is by quarantining the workers, you actually discourage others from going to those places. Jeanette Reyes is standing by for us live this morning in the Satellite Center, and she has a closer look at that aspect of this story. And all these things are interconnected. Jeanette, good morning.
That's right, Dave. Good morning to you. Certainly a lot going on when it comes to Ebola. I got to tell you, the battle over the virus has politicians even more divided, although it is much quieter here at home. We're noticing, Dave, that officials here are really working in partnership. You heard Maryland officials there. Governor Martin O'Malley just got off that press conference, actually a phoner with some officials with the Virginia Health Department. They actually had very similar kind of approaches to dealing with this in Virginia. So just briefly, I should tell you, 53 people have arrived, passengers from West Africa, since they started screening at the airport. Most of them have been screened, but moving forward, travelers must sign an agreement actually saying that they will kind of work with health officials if they show any kinds of signs, any symptoms of Ebola. There will be, at this point, no plans of involuntary quarantine like they are doing in New Jersey and New York, but officials did say they have every legal right to do so if that is necessary. So low-risk passengers will have daily phone contact with health officials, while moderate to high-risk passengers will require a daily visit. Now, I should get to what's going on in New Jersey. This all comes as New Jersey Governor Chris Christie and New York Governor Andrew Cuomo really face increasing scrutiny for their approach. Both recently implemented a mandatory 21-day quarantine for anyone who has had contact with an Ebola patient. Right now, nurse Casey Hickox is in isolation at a New Jersey hospital. She helped treat Ebola patients in Sierra Leone, but has tested negative for the virus twice. Take a listen to what Hickox had to say to Governor Christie about what's going on.
The first thing I would say to Governor Christie is that I wish that he would be more careful about his statements related to my medical condition. I am not, as he said, quote, unquote, obviously ill. I am completely healthy and with no symptoms.
And New York City Mayor Bill de Blasio called her treatment inappropriate. And Dr. Anthony Fauci of the National Institutes of Health says the move could discourage other health workers from going to West Africa to fight the virus. And Dave, I got to mention this. I'm wondering if you've noticed this as well, but this is really kind of striking that so many people in the public, Americans, are overwhelmingly siding with government officials when it comes to this. You have people like Dr. Anthony Fauci, who's really the top in his field in the world, saying that he is against this mandatory quarantine, that he's against flight bans coming out of West Africa. But it's really interesting to see so many people siding or really going against these health experts. But that should give you a strong indication of how fearful people are of the virus. But as Governor O'Malley said, it's really highly unlikely that there will be a major outbreak in the states. Back to you.
Yeah, you're right about that, Jeanette. It was interesting. I thought that the governor said two things. One, fear is of no use to us, and that's a quote. And the other is that he said all of their decisions on Ebola and how the state will proceed will be guided by science. And that's been the big criticism, particularly about what happened in New Jersey and in New York State. Jeanette Reyes for us live this morning in the Satellite Center. Jeanette, many thanks. This programming note for you, and we hope that you will join us tonight at 7 live here on News Channel 8. We've got our town hall meeting, Ebola in America. It's your voice, your future, and we've got a panel of health experts and elected officials, and you can ask your questions of them. Tweet them to us at #YourVoiceYourFuture, and we'll pose those questions.